Greetings, everyone, and welcome to the Haelan Nurse Chronicles. My name is Dr. Lori Laws, and today we will be delving into another example of nurse gaslighting, as reported in a thinly veiled article that discusses the critical impact of social media on young persons considering joining the profession of nursing. As well as we'll be exploring the current state of the nursing profession based on recent data. So please join me today as we unpack a lot of the challenges and opportunities that are facing us today in nursing and indeed in healthcare. But here's the thing about the article that I'm going to discuss today. When this information was recently published, in an online edition of the prominent periodical, The Hill, when they published their story, the headline blamed social media as the reason that prospective nurses are choosing not to enter our dumpster-like working conditions in the profession right now. Millions of nurses are in toxic workplaces, working with unsafe staffing ratios and insufficient resources. And this article spun it as though it were the fault of TikTok and other social media outlets. So here is another example of nurse gaslighting. Now it's social media's fault. Well, it couldn't possibly be due to the broken healthcare system, profit-driven roles, severely understaffed or under-resourced working conditions. Couldn't be that. The Hill reported in its recent report from a nursing marketplace platform called ShiftKey. And in that ShiftKey report, it was revealed that some members of Gen Z that were interested in pursuing nursing careers were being deterred by the negative social media content on various platforms. Now, when you really, I went and looked, as we all should, I went and looked at that ShiftKey report, and they surveyed 1,000 people aged 18 to 26, and they were shedding light on the detrimental effects of social media on aspiring nurses. Now, there's no argument that social media has tremendous influence, but is it the sole factor that's deterring prospective nurses from entering our profession? Or are they seeing a bird's eye front row seat as told by the nurses who are reporting what they're experiencing in social media? I'll leave it to you to decide. So the report is consistent with the evidence pertaining to why nurses are leaving or not entering the profession, but there was a media spin that blamed it on social media. When you start really looking at the ShiftKey data, it actually aligns with the 24/24 State of the Nursing Report that reported that 54% of nurses are dissatisfied in their roles. Only 24% of nurses express optimism about the future of nursing, including, a trend. It's really a trend about what is happening in the nurses. More and more nurses do not have optimism about the profession or its future. Nearly 60% of nurses reported in this study that reported burnout. 64% of nurses, 2 in every 3 nurses, are facing mental health challenges, which is absolutely highlighting the pressing need for systemic change. Over half of the nurses, 52%, feel unsupported at work, and about the same number lack adequate backup. Nearly 60% of nurses, at least nurses here in the United States, believe that profits are prioritized over patients and nurses, underscoring the urgent need for a shift in priorities within healthcare organizations. So when we unpack the source that The Hill is citing in their article and review the bullet points that I outlined above, it's clear that the media spin doctors are doing what they are doing best, which is obfuscating the truth. As nurses, we all know what's really happening. Now, here's a brief outline of the talking points and the evidence that was brought forth in the report. It said for nurses planning to leave their current positions, they do so for these reasons: the desire to make more money. They're frustrated with the current administration. They have a high need for better staffing ratios, which reflects the systemic issues that have been plaguing the nursing profession for decades. They need to transition away from bedside nursing, or they have a desire to pursue further education, or they just need to explore alternative nursing opportunities. So despite some recent improvements in pay, nurses still feel underpaid and overworked, with a record number of nurse strikes demanding for fair compensation. The average annual salary for nurses ranges from $61,000 to $90,000 per year, and that aligns with the same data from the U.S. Bureau of Labor and Statistics. However, 29% of nurses, over 1 in 4 nurses, are relying on secondary form of income, right? Nurses are having to side hustle to make ends meet, which indicates that we have a financial strain within our profession. So the nursing shortage, we all know it's there. Is it a nursing shortage, or is it that nurses are just unwilling to work in these harsh and toxic work conditions? Depends upon who you read. But the nursing shortage will go with what the narrative is. It remains a pressing issue. 84% of nurses believe it's getting worse. Now, factors that contribute to either the nursing shortage or the staffing crisis, depending upon how you view it, include burnout, nurse-specific traumatization, poor working conditions, and inadequate pay. Nurses are emphasizing the need for improved staffing ratios, better compensation, enhanced working conditions, and the need to retrain nurses and attract new talent to the field. So it's what we've been talking about all along in our Haelan nurse community, is that nurses need to be safe and professionally well so that we can care for our patients and bring them the highest quality of care and the best outcomes. It's not rocket science. But nowhere in the actual report from the in the shift key data or the 2024 state of nursing, nowhere in those reports was social media cited as a factor that was contributing to attracting or retaining nurses. But they took the position, let's blame it on social media. It's TikTok's fault. Well, that's just more gaslighting. Literally nowhere is social media cited as a factor for nurse retention or recruitment. All right, so what we have here is immense nurse dissatisfaction, and the implications of nurse dissatisfaction are far-reaching and have detrimental effects on patient care, safety, and outcomes. When nurses are dissatisfied and unwell in their roles, it's natural that they would be less engaged, less motivated, and more prone to making errors, right? And that's not any fault of any one nurse. That is a result of a traumatized nervous system and the cell danger response, to which, over a sustained period of time, starts to shut down the mitochondria because we need to conserve energy. So this isn't a nurses are just not doing their job. This is that we have been traumatized and have been exposed to prolonged chronic trauma and stress that has resulted in physiological consequences that look like we are making more mistakes. It looks like we might be less engaged. When in fact, when you look at it through the lens of polyvagal theory, as I have done, it's really that our dorsal vagal aspect of our vagus nerve is coming online and putting us in energy conservation mode because it's all too much for any one system to endure. That's what's really happening. We all know that high levels of nurse dissatisfaction can lead to increased turnover, and then that further exacerbates this nursing shortage or this staffing shortage, right? We probably have enough nurses, but we don't have enough nurses who are willing to work in a dumpster fire that's on, that is the workplace in many cases. All right, and it's really challenging to maintain adequate staffing levels. And so now we have this positive feedback loop. You know, we don't have enough nurses. Those who remain are even overworked even more. And then they want to leave the profession and they're, you know, I mean, I've had my nursing students report that their preceptors, and this includes my own daughter when she was in nursing school, among the hundreds that I teach each year, that our preceptors out there are saying, run, don't walk from the profession. Get out while you can. This is what is being transmitted because that is how harsh the reality of nursing is right now. So it's like a positive feedback loop that is left unbroken. And if it's not redirected, it will continue to have deleterious consequences for nurses and patients alike. So we need change. We need to look at this data from the 2024 State of Nursing Survey and the Shift Key data and really look at it, and not just nurses looking at it, because we know what's really going on, but healthcare organizations and policymakers and stakeholders need to look at these systemic issues that are facing the nursing profession. We're all out there advocating for improved staffing ratios, better compensation, and improved working conditions that are safe and supportive of our well-being so that we can ensure a sustainable and thriving workforce. But here's the catch. Here in the US, the for-profit healthcare system doesn't want to address these issues. It's not in their financial interest, nor is it in the financial interest of their shareholders to do so. So that's where we come in as a global nursing workforce that represents 30 to 50% of all health professionals. It starts with each of us as individual nurses. We must heal from all that we've endured, learn how to insulate ourselves from the broken systems and toxic workplaces in which we work. Then we come together in our teams, in our units, our organizations, our states, and our nations to say no more. It's time to end nurse gaslighting and avoidable nurse-specific traumatization. It's time to usher in a new era of nursing that prioritizes nurse safety and professional well-being. You can start by doing your part today. You can learn if and how you've been affected by taking a 1-minute self-survey that I've prepared for you. We'll drop it in the show notes. After you take this self-survey, you'll learn what your nurse burnout indicator is, and we'll send you a complete report, no spam, no shenanigans, along with actionable steps that you can take today or whenever you're ready. You could also consider attending my free 90-minute webinar. There, I'll unpack the silent epidemic that is affecting millions of nurses, perhaps even you. We'll drop that link in the show notes as well. So stay tuned for more insightful discussions on critical issues impacting the nursing profession in my future episodes. Until next time, thank you so much for the important work you are doing and all that you are. I see you, I feel you, I hear you, and I'm here to help however I can. From my healer's heart to yours, and until next time, namaste.